Hi guys, John Adamson, the Rehab and Documentation Guru. Sometimes doctors get it right. And I wish I could call this doctor out because I think this doctor is really good. But I was dealing with a patient who has Parkinson's. I'm growing to love working with Parkinson's patients. I really have a heart for them. I see their struggles. And I know sometimes there's things that we can do for them that are positive despite the progressive nature of their disease. So I had a Parkinson's patient I saw the other day, and he was a little more advanced than the typical one that I have seen. And the bradykinesia that he has is obviously very impactful. I noticed, for example, right off the bat that he had a lot of facial masking, which is that flat affect appearance, despite the fact that he was obviously joking and in good humor, yet, very flat affect in his face. So he had facial masking. He also had the resting tremoring pretty badly, one hand versus the other. And then you can really see the bradykinetic influence throughout the evaluation. And he told me about his handwriting, that it was basically a straight line at that point. So he got it. He knew it. He was cognitively intact, which is a good thing. I couldn't see any influence of Parkinson's-related dementia. And I also noted that he had fairly high blood pressure. Now, I've mentioned this in a previous video. It is important that when your patient is on dopamine replacement therapy, that you measure for postural hypotension. It is a concern. It is a side effect of dopamine replacement. And so I always check for postural hypotension. What was interesting about this guy is he had no influence. In fact, when he stood up, I took an immediate blood pressure because I wanted to see if I got that drop. Nothing. In fact, it went up slightly. So that, coupled with the fact that he was already high, coupled with the fact that he was bradykinetic, coupled with the fact that he, even though he's on dopamine replacement, he's not on the highest possible dose that he could be. So I contacted the neurologist and just let him know what my findings are, and I very nicely asked, based on these findings, do you believe that there's opportunity for greater dosage of dopamine replacement meds? And the doctor was basically very congenial to that, very open to that, and said, let me know when his dosages are and what you're seeing. That's very cool. And I think this doctor trusts me because I've dealt with other patients with Parkinson's that this doctor has seen. And so this doctor has seen my clinical knowledge related to what the doctor's doing applied to the therapy realm, so is willing to work with me. So I bring it up as a case study, but also I wanted to give a shout out. I kind of railed on doctors the other day, but there are doctors that are responsive, that are collaborative, that respect us as clinicians. And sometimes it's just a matter of building some of that trust between us. But also just a reminder to look at your patient's pharmacology very carefully and look at whether or not there's opportunity for additional meds. Don't just assume that the meds that they're on are where they need to be. Because doctors, I think, sometimes take a shot in the dark. They give a patient a med or they increase a med. They see that patient once every 3 months or whatever it is, hoping that that med is doing what it's supposed to do. And if we're in the front lines working with these patients regularly, we get an opportunity to see physiologically, mobility-wise, psychologically, cognitively, how these meds are impacting their performance. We should be collaborating with those doctors very strongly for the best possible outcome for our patients, because that's where it's all at right now, outcomes-based payment models. So by doing this collaborative with your doctors, you may get a much better outcome for your patient, and that's where it's all at. So anyway, John Adamson, the Rehab and Documentation Guru, giving you a case study, encouraging you to look hard at pharmacology. And I'm sorry I got kind of on a little bit of a rant there. I didn't mean to. But anyway, take care. God bless and have a great night.